Hello, this is Shakil Ahmed. In this tutorial, we will discuss about the diagnostic tests, and we just evaluate the performance of diagnostic test in medical studies. Usually, we use certain type of test to uh, diagnose whether the patient has a disease or not. So we need to check or evaluate the performance of those tests based on certain gold standard or the some reference test. So when we have some perfect reference, then we can directly compare with that value. But in case of imperfect references, we just check the agreement whether the two responses are same or not. But here the we have true values, true responses. That is basically we have applied or we know from a stronger uh, device or tool that is standard, and there is no chance of error. And we are using, for example, we have proposed a new diagnostic tool or method, and we want to test whether how the performance of what how the performance of uh, the newly developed diagnostic tool is different from the existing one. So here we have a data set on, for example, again 37 patients, and the test was used for, and we have data on the reference for the reference test, and we have data for the new test. Here, test refers to the medical test, not the statistical test. The patient is tested for example, the patient was tested for positivity of COVID-19. So whether the patient has the disease or not, that is tested using a different type of diagnostic tests that is mostly conducted in laboratories or in hospitals. So we can assess the performance of these tests, how uh, the tests are uh, performing the intended task. So we have the frequencies. For example, I will just use the values as we have already obtained the values using McNamara test while using McNamara test. So I'm just copying the values here. So these are the values, for example, 17, 18, 17, 6, 5. I have just pasted the formula, so it's already calculated using this data set. So you can see that this is the count of count if, and when the uh, new test says it is yes, and the patient has the disease, and here it is negative and the patient has the disease, you can write it here as disease and non-disease or no disease, and here you can write positive, and so you can't use the sign, you can just write positive, it becomes the formula, so you can just write positive and here negative. So this is the true positive. This is called the number of true positives, as these individuals have the disease and they are tested positive, and these are the false positive, as these are tested positive but has have no disease, and these are false negative, as these individuals have the disease but they are tested negative, and these are the true negative. So you can just write the first entity as true positive, and false positive, and true negative, and sorry, this is true negative and this is false negative. So these two are the uh, we can just color. These two are the true, the correct answers are correct responses as they are true, whether as the individual has the disease and he or she is tested positive, or the individual does not have the disease and she or he or she is tested negative. So we have these four responses. These two are error and these two are correct responses. So we can just perform the we can find the prevalence of the disease. Prevalence means how many people in this study has the disease. So that is 17 plus 5, it's 22, and 6 plus 9, it's 15, and total is 37. Here 6 plus it's 23, I think, and this is 14. So it again summing to 37. So the prevalence of the disease we can find. You can just write the true positive 17, false positive 6, and true negative that is true negative is 9, and false negative 5. And now we need to find these mayors. The prevalence is the proportion of people have the disease in the study, that is 22 divided by 37. So it's 22 divided by 37. This is the prevalence of the disease is almost 60%. You can just write in 60 percentages. 22 divided by 37. And the sensitivity means the true positive divided by total positive. This is the proportion of positive that are tested positive. So that is 17 divided by 22. So it's 77.3%. People have the disease and tested positive. This is called sensitivity. And specificity is these two are basically we are finding on column wise based on people having the disease and based on the people who don't have the disease. So it's true negative 9 and divide by total negative. How many people have the disease does not have the disease? That is 0.6. So this is the specificity. And what is positive predictive value? Positive predictive value is basically obtained as the uh, we are interested in number of total positives rather than number of people who have the disease. We can find a proportion how many people were tested positive, and among them how many has actually the disease. That is our concern. So we can find the number of proportion of positive predictive value, that is 17 divided by 23, and the negative predictive value, number of negatives divided by number of people, uh, number of total negatives. This is basically number of people who are tested negative and actually does not have the disease and don't have the disease, and the total number of negative, so it's 64%. So these are the measures we find based on the uh, different characteristics of the patients. And what is positive likelihood ratio? So we have two types of likelihood ratio. One is the positive likelihood ratio, and the second is negative likelihood ratio. Positive likelihood ratio is the sensitivity divided by 1 minus specificity, and negative likelihood ratio is 1 minus sensitivity divided by specificity. So you these are used as as a measure of basically having a correct answer. So how we can find the sensitivity is, uh, we can just find sensitivity divide by 1 minus specificity, and this is 1.93%. And again, the ratio of negative likelihood ratio, that is 1 minus sensitivity divided by specificity. So it's 0.37. So these are basically the ratios. We are comparing the proportion of people who uh, are tested positive among the positive cases, and divide by the number, 1 minus number of peoples who have the disease, but uh, given uh, the total number of positive people, positive individuals. So 1 minus specificity, basically 1 minus 0.60. You can see how we can basically uh, the probability of the sensitivity is proportion of 17 divided by 22, and specificity is 19 divided by 15. So 1 minus specificity becomes 6 divided by 15. So we are just using the ratio of this proportion and ratio of this proportion. So definitely, if this proportion is higher than this proportion, then we say that the test is performing good. And the pre-test odds, we need to find the pre-test odds. That is the prevalence divided by 1 minus prevalence. This is called the odds of having a disease before performing the test. That is called the pre-test odds. And post-test odd is just obtained uh, just by multiplying by the likelihood ratio by the pre-test odds. So first we need to find the pre-test odds, that is prevalence. What is the prevalence? This divided by 1 minus this. So this is pre-test odds, and we can find the uh, post-test odds. How we can find the post-test odds? This is just the we can find the positive post-test odds by multiplying the positive likelihood ratio multiplied by pre-test odds. This is the positive post-test odds, and you can find the negative post-test odds again, and then you can find the posterior probability or the post test probability prevalence, that is basically post test prevalence that is obtained using the odds. You must know the relation between odds and prevalence. You can just change. We can just find prevalence from using the odds, using this relation. So this becomes just like this. So post test odds divided by 1 plus post test odds. So I have just written here You can see posted odds plus 1 plus posted odds. So this is positive posted probability prevalence. You can see after performing the test. This is just equivalence to the positive predictive value. You can see just this one. And this is also called the posterior probability of having the disease once the test is conducted. And that is of mostly and the researchers are interested. So that's all about the prevalence, sensitivity, specificity, positive predictive value, and the negative predictive value, positive likelihood ratio, negative likelihood ratio, pre-test odds, and positive post-test odds, and positive post-test probability. So you need to find all these things to evaluate the performance of your test. If you have any question, you can always write in the comment box. Thank you.